Alright, so I'm going to talk to you about everything deep resurfacing laser. You've considered this, you've likely had an appointment, and if you hadn't, then it's really important that you book in so we can kind of feel the skin, we can analyze the skin, learn about you, and if this is the right decision for you. So a consultation will delineate the best option for you. We have a variety of lasers, and sometimes it's a combination so you mightn't expect. Everyone's different, everyone's skin has different demands. The deep resurfacing laser, I would call this laser surgery. This has got a more significant downtime, it takes more preparation and more significant recovery. It's one of the most phenomenal tools we have in aesthetic medicine, and it's really exciting to see what can be achieved. So when we talk deep resurfacing laser, this is largely a face treatment, and our two biggest focuses with deep resurfacing laser is largely going to be around the eyes, where we're trying to kind of smooth out textural changes, excessive sagging of the under eye skin, some of the crepiness of the under eye skin. It's a little bit over the upper eyelids to kind of soften and tighten up that skin as well. For the under eye in particular, our deep resurfacing laser, which is an erbium YAG laser, second most common or equally most common would be around the mouth. The mouth textural issues around the upper lip, those lines, those smoker line, barcode lines, just constriction lines that we see appear with time as the skin has changed. So we go actually significantly deep into the tissue, treating the laser almost like an eraser to erase those lines right down to their bases. And this is going to come with some recovery. Because we're getting rid of all the epidermis and part of the upper dermal tissue, whereas the rest of the face we tend to use more fractional lasers to kind of improve the quality, stimulate collagen. With the deep resurfacing laser, we need you to kind of understand what you're getting into. We need a plan in place. There's things you're going to need at home, preparation, and some of these are comfort measures. Some of these things are just to optimize a clean, healthy, and safe recovery. That can be as simple as having fresh pillowcases ready. We're going to want you sleeping on an extra pillow. I want you slightly elevated, especially those first couple nights. And of course, if there's any pain in those first few days, we can help with some pain management strategies as well. For the fractional parts of the laser, it's really important to have healthy, strong skin. So if you're a smoker, it's ideal if you can discontinue smoking. We know this isn't an easy task, but this does improve your recovery in your journey through a laser process. On the day of, we want you drinking water. We want you well hydrated coming into these. We are going to give you something to relax and something to optimize your journey. So we need you to be driven to your appointment. We are going to give you a docket. It has 8 to 10 pages of things you might do in preparation and where to contact and the whole process. Aftercare is really, with a deep laser, is protecting the barrier. You don't have a superficial skin for that first 3 to 5 days, so we need you to use barrier creams such as Vaseline or Aquaphor to protect those exposed areas, because they will be like an open wound. They will be oozy, there will be some bleeding and some sloughing of tissues, which we think it's really important that you know about this in advance of the treatment so that you're not intimidated or concerned. We will be watching you through this whole process, and we want to make sure that you're kind of armed with all the knowledge of what to expect on day to day, as it's a fairly routine recovery for most. After those first 3 to 5 days, a lot of the early epidermal tissue, which is your top layer of skin, will begin to recover. It's going to be very sensitive, it's very new, and so we need to protect it and be very delicate with it. Through those days, we'll be discussing things like vinegar soaks to keep the scabs off, to reduce any risk of scarring. The tissue is going to be quite red and easily disturbed, so we want you to protect that skin. It's really protecting an open wound. It's really important that we look at it as surgery, because there is a recovery to it, and you should be delighted that there's a recovery to it, because you have to recover from something to get the results you're looking for. I need you to have that downtime, but it's walking you through that. So we use a lot of LED, reds and near infrared light to reduce inflammation, help control that redness. So as we kind of bring redness into the conversation, this can be the bugbear of a deep resurfacing. For the majority of people, 3 to 6 weeks, a lot of the post-inflammatory erythema or redness will have settled down. And you might see it flare up a little bit when you're exercising, spicy meal, maybe a little bit embarrassed. You'll see that redness kind of come to play, but that will settle down. There is a small selection of people that this can take 3 to 6 months on. We do have other adjuncts that we can use to help control and reduce redness that is lasting, from topical ointments to BBL or clear silk to help control redness within the skin. This is not a commonplace, but it is an eventuality that we are prepared to manage. We are going to be holding your hand through this entire process. We are checking in on you. We're bringing you in to make sure everything's clean. We're putting you under the Dermalex both in clinic, and you'll take one home for that first week, just so that you can aid in your own recovery. And then we'll be back to using our actives and makeup and all these kind of things after about at least 2 weeks, maybe even longer. Advising you based on how everything is developing, healing, and progressing for you. The big steps is going to be keeping this clean, keeping it protected and hydrated is going to be your first 2 weeks. After 2 weeks, we're kind of laughing down the road of recovery. We're to a much easier place. After 2 weeks, we've done a lot of the more difficult healing, and then it's just the collagen stimulation and the recovery. Sometimes, as the tissue has been dehydrated intentionally, it can be slow to kind of appreciate the results, but that does come as we see the collagen mature and repair over this 3 to 6 months. Our best results really appreciated at least 3, 6, sometimes even 12 months. This is not something you're going to do a lot of. Ideally, this is actually a very infrequent laser compared to our fractional lasers or our pulse lights or our LED treatments. Those are lasers that we do a lot of for our skin health, for our aesthetic outcomes, for our appearance, whereas the deep laser is something that is on reserve as a laser surgery that's done very infrequently.